Hello and welcome to It's a Code U, mental health support for those working in healthcare. This is a podcast created for healthcare employees to explore not only issues relating to mental and emotional health, but also unique challenges that those working in healthcare are faced with. Your hosts are Adina Tucker, a licensed clinical social worker with Dartmouth Health, and Jennifer Hinsey, an MSW also with Dartmouth Health. Welcome to It's a Code U. On this episode and in the next few, we are going to be talking about mindfulness. We've all heard it before talked about on social media, self-help books, but what exactly is it and why is it important? And what benefits could mindfulness practice bring to your life? And one of the most important things, how do you actually practice it? And what are real takeaway actionable steps that you can do to practice mindfulness in your life? So, we're going to get into all of that and talk about that today and really dive into what is this idea of mindfulness.
So, first, let's start by defining what mindfulness is. It's this term that I think has captured a ton of different things. It's become kind of a trendy thing to engage in or to say you're doing, but maybe most folks don't really understand exactly what it is. So, we'll try to break it down a little bit. So, mindfulness, or the practice of mindfulness, when we're actually trying to be mindful, is basically being aware of how we're feeling in the moment. And that includes things like the sensations in our body and being aware of them without actually judging what we're feeling. It's the ability to be fully present and focused on where we are, what we're doing, and not allowing our focus to shift to outside things or situations or thoughts of thoughts of the past or the future or our work stuff that's coming up or all that stuff. So often we think of being present with things like putting our phone down when we're having dinner with someone so we can really be present in the moment. But something really important and beneficial about being mindful is just allowing ourselves to be fully present with ourselves. So that means focusing on how our body feels, what we're feeling, and accepting what those things are without trying to interpret them, attach meaning, trying to think more about them, or maybe getting into a spiral about what that could be. It's really just noticing that those feelings are there and just allowing them to be.
So, let's get into what some of the benefits of practicing mindfulness are. And these are all been proven through research as different things that can be helpful and different benefits you can have. So, practicing mindfulness in your daily life can reduce stress. It can help you gain self awareness and insight into yourself, how you work, what's important to you. It could also improve the performance of your working memory. And there was actually a study done that I shared with Jennifer because I thought it was super interesting with military recruits in training. And they found that after practicing daily meditation, their working memory actually increased. And that's important because stress can negatively impact our working memory. And now they've even instituted a program called mindfulness based attention training that's specifically designed for military populations. So I thought that was super interesting, especially for people who work in high stress environments like healthcare workers, right? And so your working memory is being affected by that stress. So practicing mindfulness could actually help combat that and increase it. It's also important to know that mindfulness practice has been shown to have positive benefits for health, overall happiness, work life, and in your relationships. It can help reduce anxiety and depression symptoms, and it can just help improve your overall quality of life.
Yeah, that's excellent and really fascinating, the study using it in military populations. And certainly, yeah, I agree. Healthcare folks could definitely make use of mindfulness skills as well. And I think, too, it's really important to just know that mindfulness and the different mindfulness practices are evidence based. So this isn't something just We're drawing it out of the air. It's not just something that's caught a trend in the moment. There really is evidence to support all of these different benefits that Adina just mentioned. And because with regular practice of different mindfulness exercises, it's kind of like rather than being led on autopilot by our emotions or being influenced by negative past experiences or fear of the future, we really can teach ourselves to harness the ability to root our mind just in the present. And maybe, hopefully, with more practice, deal with life's challenges in a much more clear minded, calm kind of way. So, we're going to talk about a few different practical ways that we can practice mindfulness in our everyday life. So, journaling, of course, can take many different forms. Perhaps you are interested or lean more towards gratitude journaling. So, listing out a few things each day that you are grateful for, or even journaling to just check in with yourself. So, you can journal about progress that you've made towards different goals you've been working on, roadblocks that maybe you're dealing with, or even if it's just a matter of coloring and doodling. And there's a type of doodling specifically called Zen doodling that I actually learned about recently from one of our providers, Stephanie Chestnut, who you might have heard on a previous episode and forthcoming episodes too. But Zen doodling is where you really just allow yourself to take your pen, your pencil, your whatever it is you're using, and allow yourself to just doodle, freely doodle. There's no judgment, there's no constraints, no expectations. You just allow yourself to be in the moment and create in a very simple kind of way. It's very soothing. There's also a body scan, and this is a type of meditation that focuses on paying attention to each part of your body and any sensations or feelings you're having at each particular part until you work your way down or up your entire body. Now, I will say body scans you can go for a really long period of time. You can even make them as simple as like a 2-minute sort of exercise.
A couple of other practical ways to practice mindfulness are meditation. And we've all heard about meditation is pretty effective to reduce stress. It is a way to train your attention to get to a mental state of calm concentration and positive emotions, according to the American Psychological Association. Your attention gets focused on what's happening in the present. So, shifting awareness to your breath, your thoughts, your physical sensations, and acceptance during meditation means that you observe your feelings and any sensations without judging or responding or reacting. You just take note of them and let them be. And there are meditation classes you can take. There are scripts to start practicing on your own. There's a bunch of different types of meditation. So you can really go down the rabbit hole and find what works best for you. There's also daily gratitude practices. And gratitude can be associated with sleeping better, lower blood pressure. It can also help strengthen your relationships, and it can help increase self-esteem. And different ways you could do that are you could do a gratitude journal, which we talked a little bit about, where you can write down what you're grateful for each day. Or you could even take a break during your day to think of something you're grateful for that day, especially if you're having a bad, negative day. You could take a walk and notice the sounds, smells, sensations, sights, and tastes, and acknowledge the things that you come across that you're grateful for the experience of. Then there's also grounding techniques. And these are a form of mindfulness, but they are also often used when someone is feeling overwhelmed or anxious. And these are ways to actively focus your attention on the present moment by using senses and physical sensations. And these are ways to really anchor you in the present. And that's what kind of helps diffuse out any anxious thoughts or feelings. And if you find one that works well for you, they can be pretty effective, honestly. My favorite grounding technique that I use, that I actually stole from a client because they told me that they do it, is ice. I will take, usually, I'll take one of those lunchbox ice packs that's like just, I keep in there frozen, and I put it on my chest. And that I just leave it on there for a few minutes and just hold it and take deep breaths and just concentrate on the cold feeling. And that actually is very helpful with bringing down some anxiety. And every time I have a client who has anxiety now and I'm going over grounding techniques, I say, try the ice.
That is a good one. And it's a pretty fairly easy one that you could do if you have access to ice or cold something, or even just like cold water, and maybe just sticking your hands out and running them under cold water in the moment. Yeah, that's a great one.
Yeah. The cold water is a good one. And the same person said if they don't have ice, they'll do the cold water. Cold water on your face, like just putting cold water on your face, if you're able to do that, is also a good one. Cause again, it's that same kind of like shock of focus on this thing.
Yeah, yeah, that's a good one. I will say one of my favorite mindfulness practices is actually you could tie it into a grounding of sorts if you get into a texture sort of thing and like feeling the texture of something. But really, I find it helpful if like you're getting anxious or worked up in a situation where you're waiting in line at the DMV, right? Or maybe you're in a jam-packed hallway. There's a lot of chaotic stuff going on. Now I think about outside of in a kid's auditorium at school, and everybody's just moving around. It's chaos, but you can't go into the auditorium yet. And it's always loud and echoey in there, right? And you have nothing you can do but just stand there and wait for the thing to happen, that everybody can start moving again. But I like to pick a point in the room and just notice something to observe. So maybe that's like the way the rafters are crisscrossed in the ceiling, or even like grout in between tiles on the wall. And really just spending a moment observing the texture, observing the material of it, just thinking a little bit about how did this structure come together? And how many grains were required to make this section of grout? And it might sound a little bit silly, but in that moment, as you're concentrating on just this little particular feature of wherever you are, it is a little bit like giving your brain a break from all the stimulation around you. And I find that it helps me appreciate too just a very simplistic piece of my environment that maybe I otherwise would have never noticed before. And of course, you can do this anywhere really. And I think somewhere out in nature is a great place to do it too. And it might be a little bit easier and more interesting than grout between bricks too for folks. You never know. But yeah. But anyway, you could tie it into a grounding thing too. If, you happen to be standing by that wall, and then you take your hand and you feel the texture of the brick or feel the texture of the grout. And then you can connect those senses with that whole observation experience too. So, yeah.
Yeah. I think that's what I like about hiking is that, especially if it's quiet, is just like being able to smell how the air smells different and listen to the sounds that are happening and just taking everything in. It's really makes you focus on the present. Another grounding technique that I do which I did yesterday because I had to get an MRI, and turns out I am a little claustrophobic, which I knew. So as soon as they put that little thing on my head, I closed my eyes immediately and I was like, and now. But I do this sometimes. Sometimes if like when I lay down to go to sleep, I start having the running thought of whatever's going on or things I need to do. And then sometimes that makes me anxious. And I'm like, I just want to go to sleep. I got to get up. So I will actually close my eyes and start at 100 and count backwards and just take a deep breath and be like 99 in my head. And then I never make it all the way to when I usually fall asleep. But I did that yesterday because I was like, all right, I don't want to freak out. I want to squeeze the little thing and be like, let me out of here. So I did the counting and it was like, I don't know how, it was like 10 minutes or something. It felt longer, but I had to start over. I got all the way to 1 and then I was like, okay, and now we'll start at 200. But it helped me to not get real worked at.
Yeah. Yeah. That's great. And that's certainly a good spot to test that out. That's great. Good you found that it worked for you.
Yeah, especially when you're trapped. I've also started doing well, I journal anyway, but I've started just adding a little gratitude journal at the end. And because I feel like years ago, and I think I've mentioned this in other episodes, somebody on Facebook did the whole in November, like day one, I'm thankful for whatever. And I remember thinking, like, that's so silly. And then I finally gave in. And then I was like, wow, I feel better. I feel better just by acknowledging that, especially I feel like on the hard days, I noticed it because my kids were little and it was stressful. And sometimes I had nothing left to give. And I'd be like, I'm thankful for nap time and coffee. And then, but then it was like, okay. And I got through it. And now here's the next thing. So I've started doing that recently, just trying to think of each day, just like things I'm grateful for. And it really does change your mindset. So and it's easy to do because there's always something. It might, maybe it's only coffee, or maybe you write with a purple pen and you love that purple pen. It can be the simplest of things.
Mhm. When there's so much good research supporting gratitude practices and the benefits of it. And so and this, I don't have the exact study in front of me, but one of the many studies done in it found that there's like a snowball effect to practicing gratitude, right? When you do it so many times and it can become a habit, it's easier to identify things that you are grateful for. So then you have this nice compounding positive effect. But what's also interesting about that is in the study, they found that when folks stopped their active gratitude practice, and in the study, they were writing letters of gratitude every day or every week, the benefits of that practice, even though they stopped that particular week, it continued on for at least 2 weeks beyond actively practicing it. So that's a pretty compelling evidence of, hey, practicing gratitude every day can really change your outlook on life for the better, boost your happiness and all that good stuff.
Well, it's just like classic CBT or cognitive behavioral therapy techniques that we use a lot in therapy to combat like negative self-talk and stuff. But to me, just feels like that. It's like change the lens at which you see everything through, and it
Yeah.
then changes the way you feel. So I'm grateful for gratitude. And next, Jennifer is up with mindfulness practices in the healthcare setting. Take it away, Jennifer.
So, since we're a podcast dedicated to serving employees who work in the healthcare setting, we also wanted to make sure we talked about how mindfulness, it's not only beneficial to folks working in this industry, but also it can be a practice that is still very accessible to you. So even in the midst of high chaos, fast-paced jobs, or even during literal life or death situations, healthcare workers tend to encounter. So, first, let's talk about why mindfulness for healthcare professionals specifically. Well, it may not come as a surprise if you happen to work in the healthcare industry that research shows that baseline rates of burnout amongst physicians were around 50%, and that was even before the COVID-19 pandemic. So, fairly high rates of burnout. But since COVID, those rates have increased. And recent data shows that 60% of healthcare workers report that their mental health has suffered over the last year. And I know that from the patients you and I see, Adina, burnout is definitely an issue folks are struggling with. It's on their mind. It's an ever present issue, unfortunately. But for doctors and providers, mindfulness practices can ease these symptoms. Might not be a cure all, but it can certainly ease the symptoms while also improving engagement, a sense of meaning at work, and improving the ability to navigate difficult conversations with patients and to feel empathy, right? Because compassion fatigue is definitely a thing too, if you're in the healthcare industry. The enhanced self awareness and emotion regulation that can come from daily mindfulness practices also enhances teamwork, can help with decision making, and ultimately patient safety. And finally, as we mentioned previously, mindfulness can improve emotional intelligence, it can help with our sleep, and it can definitely contribute to building overall resilience, a really important quality for our folks in the healthcare industry. So, what can healthcare workers do to incorporate some mindfulness practices into their very busy routines? Well, you can definitely engage in some of the practices we've discussed above, like the journaling, the body scans, grounding techniques. And we get it that you likely need something a little bit more accessible and practical. So we've laid out a few simple practices, three, that healthcare workers can use on the job, on the go. And if you're in healthcare, you know that those two phrases are usually simultaneous. So keep in mind these practices are not a band aid, they're not a fix for anything in particular. They're really an acknowledgement that when we're knocked off balance, when we're feeling burned out, when we're caught up in a lot of stress in the day to day, there is value to having some tools that we can use to settle ourselves in that moment and hopefully, like we said, build up our resilience. And also, these practices are recommended by Dr. Mark Birkin. He is a pediatrician and author, professor, and a mindfulness teacher specializing in neurodevelopmental behavioral pediatrics. So, Adina, do you mind to introduce our first healthcare mindfulness practice?
Sure. So, first, we're going to do a simple breathing practice. And with each movement of the breath, there is a physical sensation, and that sensation is always here. It's a way to adjust and come back to what we are meant to be doing in the next moment, or what would be the most valuable thing we can do for ourselves or for someone else. So take the next 7 breaths with that perspective. You can start wherever you are. You can be sitting or standing. Breathe in 1 and breathe out 1, and continue with this rhythm for 7 breaths. And this is something you can come back to after a crisis or before going into a challenging moment. It's a good way to ground yourself and find a way to settle down, especially if you have something. Sometimes I used to work in inpatient hospitals, and sometimes you'd have a patient who is having a crisis and you are just doing all the things, and then everything's better, but then sometimes you're still in the crisis mode. So this is a good way to just take a minute and bring yourself back to baseline.
Hmm. Yeah, that's great. Right. And in those high crisis situations, high moments of chaos, it's really easy to absorb the emotions of the room. And when that happens, our critical thinking can end up taking the back seat. We can get really caught up, highly emotional as well. So, yeah, breathing, definitely a great way to come back down, calm yourself a bit. All right. Now, the next one, it's a mindful way to wash your hands. I know if you work in healthcare, there is a lot of hand washing going on. Each time you wash your hands during the day, it can be an opportunity to catch a break for at least a few seconds. There's nothing specifically to do or to fix or to change. So instead, just washing our hands can be a little micro point of rest. So while you're washing your hands, just bring your awareness to the physical sensation of the hot water and soap. Acknowledge this experience as something that's real and right now. Maybe even just take note of how the water sounds as it's coming out of the faucet. Incorporate a counting exercise if you can by washing your hands for the recommended 30 to 40 seconds. And again, we're not trying to force ourselves to feel anything. There's an aspect of mindfulness practice that's just simply acknowledging our experience, even if it's something as simple as washing our hands.
The last of the 3 healthcare mindfulness practices is something called the doorknob or stop practice. So, this practice starts with the assumption that if we can get out of autopilot mode, see with clarity, and practice being settled, then we're going to understand what needs to be done, or maybe that it's not the time to be doing something. So, S stands for stop what you're doing. T is take a few breaths. O is observe and check in with what's going on around you. P, pick how to proceed. Ask yourself, what is the most skillful thing to be doing next? In medicine, it's often called the doorknob practice because it only takes a few moments. each time you put your hand on a doorknob to enter a room for the next experience with another human being, whether it's a patient visit or an administrative meeting, you can take that stop practice and remind yourself, stop, take a few breaths, observe and notice how things are, and pick how to proceed with intention. I like that one. I feel like that's good for whether you're in healthcare or not, honestly. Especially if you're feeling super emotionally activated and you're more likely to be reactive to something. Do we have any other closing thoughts?
I don't, but I really enjoyed this discussion with you, and I hope folks have gotten something that they can take away that's usable, practical, and hopefully start practicing mindfulness in their everyday life.
I agree. And I think often when people do think it's like mindfulness equals meditation. And I think meditation is one of those things either people are totally into it or they think that's hogwash. That's some sort of hippie thing or whatever. Maybe I'm
Mhm.
just thinking of people that I've heard around here. But, and I think it can feel strange if you've never done it, but I think that it's important for people to know there's all kinds of different ways to practice mindfulness. You don't have to do meditation.
Mhm.
It is, I think, one of the good ways to do it, one of the best ways to do it. And there's also a bunch of
Yeah.
different types of meditation. So
Mhm.
you don't have to necessarily be with somebody and do it. You can do it on your own. But I think just finding a mindfulness practice that works
Mhm.
for you that you can incorporate into your daily life so you can have those
Yeah.
benefits. That's really the takeaway I want people to have, is to really just be open to seeing what's out there and finding what fits best for you because we're all different.
Yeah. Yeah. And it's a learning process, right? And it's skill building. So if you feel intimidated by even attempting, just remember there's no judgment in it. It's You're likely doing a lot of different sorts of mindfulness practices in your life every day and might not even realize it. But
Yeah.
it's just learning a skill and practicing, and anybody can do it.
Yeah. I agree. Well, today we have gone over a broad overview of mindfulness and what it is, why it's helpful, and a few ways you can put it into practice. So, over the next month or so, we're going to go a little more in depth with some of the mindfulness practices and give you some practical takeaways that you can use in your daily life. So, look forward to that. And we appreciate you listening. And if you have any feedback or questions, please email us at dhbhs.media@hitchcock.org. If you haven't left us a rating or review, we would so appreciate it on whatever listening platform you prefer. And thank you so much for listening.